Hello everybody in YouTube land, this is Dr. Reeves, back with another exciting adventure in talking about things that are neurologic. So fasten your seatbelts, we're going to visit Dilantin land. There's a seizure medication, chemically it's called phenytoin. The common brand name used in the United States for many moons has been Dilantin. And I want to talk a little bit about the medication. For many years, when I started doing epilepsy, in fact, which is shortly after the dinosaurs died off and before color was an invented thing, we only had 3 or 4 seizure medications. So if phenobarbital or Dilantin or later on Tegretol and Depakote didn't work for you, then we just tried combinations. So Dilantin's been around since the 30s, and it's actually a very powerful seizure medication. So I want you to understand everything I'm saying about using Dilantin doesn't have anything to do with how well it prevents seizures. It's just that if you're on the medicine for years and years and years and decades, it can have some unintended side effects that unfortunately some of my patients were never educated on. So the side effects kind of can be divided into a couple of ways. One is common and permanent. Common and not permanent, and then there's uncommon, I guess. The common permanent side effects of many years of Dilantin use include things like a peripheral neuropathy. Typically that's usually just dead numbness in the feet and a little bit in the hands, but occasionally it's painful. Usually folks don't get that weak with a Dilantin induced peripheral neuropathy. If you want to learn more about peripheral neuropathies, go watch that video. See the video. Cerebellar Ataxia is another permanent side effect of years of Dilantin therapy in many, but not everybody. The cerebellum is here kind of at the back of the brain. It's like a little outboard brain which just governs coordination and walking and coordination of our lips and tongue when we speak. So when your cerebellum doesn't work right over the years, basically you kind of walk and you kind of talk like you've had a few drinks. Because that's actually what happens when you have a few drinks. Your cerebellum says, hey, it's party time, let's stop working so hard. And the net result is we kind of walk and talk that way. So peripheral neuropathy, cerebellar ataxia, because the cerebellum kind of shrinks down permanently. Third permanent one that we worry about is osteoporosis. Being on phenytoin for years makes it easier to get weak or brittle bones, which of course, as we get older, that's probably going to happen anyway, particularly in smokers. But if you've been on Dilantin for a long time and you're 72 and then gravity happens and you fall and it makes it easier to break a hip. So those are things that we kind of worry about. Not everybody gets them. They're not always super severe. And there are times that essentially it's okay to pay the piper. The big deal is, do you know the bill is coming? The gum hypertrophy, there's this gum thing where the gums get kind of big and thick in sort of troglodyte Neanderthal-like gums. That actually will improve if people get off of the medication. Sometimes it's mild and sometimes it's not a problem. Other times it's so significant that the orthodontist wants to go in there and shave gum off. Now, so we've gone over okay, the other side effects that are reversible, being fatigued or tired, that'll get better if you get off Dilantin. Some of the behavioral changes, you know, any seizure drug can change behavior, good, bad, or otherwise. And so those would go away if you get off Dilantin. Then there's this long list of rather less common, often sort of weird side effects of Dilantin use, chronic Dilantin use. And any drug that's been on the market as long as Dilantin, any bizarre reaction that can happen has occurred. And somebody wrote a paper about it because they wanted to get that on their resume. So if you want to read up on Dilantin, you're going to find out that the stuff causes a dizzying array of unusual problems. But since most people get what most people get, and most people don't get those problems, I'm not going to shoot a whole video about bizarre or less common side effects. Those really shouldn't motivate a decision to use or not use Dilantin. There are some times we still use phenytoin or Dilantin. It has a chemical form called phenytoin, which is very useful when you just got to give somebody a seizure medication right now by vein. Not all seizure medications can be given by vein. Phenytoin, Dilantin, is one of them in its phenytoin form. And it works quite well. Another nice thing about it is the stuff's dirt cheap. It's been around since, I don't know, Woodrow Wilson was president or maybe before. So it's not very expensive, works fairly well. Some people tolerate it really well. So if you've been on Dilantin for a long period of time, how long is that? Partly depends on the person, how old you are, do you smoke, how big your skeleton is to begin with. Are you kind of petite, or are you really big and husky? And how much you're on. So if you've been on Dilantin for 5 or 10 or 15 years, certainly, you want to talk with your neurologist about, is this the best approach? Now, sometimes the answer is yes. I've had patients for whom Dilantin did a better job at controlling their seizures than anything else, and we tried everything else. Now, that's okay. Like I say, I always say that it's okay to pay the piper, you just got to know the bill's coming. Now, I do have to do a little sidebar. I got to put my smart man glasses back on, do my little academic sidebar. There are other side effects of the other drugs too. So it's not like Dilantin versus the good guy, bad guys versus the good guys at all. Another thing to keep in mind is you learn a lot about a medication after 50 or 60 or 80 years of using it. Some of the more modern seizure medications nobody's been on for 30 years. So there are some unanswered questions. Now, yes, the more recently produced and marketed seizure medications are rather more rigorously and vigorously tested than Dilantin was before it came onto the market. So we know more when they hit the market, but we don't know quite as much as 30 or 50 years of experience. So that's why we keep an eye on things. I hope you've found this beneficial, and here's to you in good health.